I'm now going to hand over to one of the many brains behind the Vision 2030 for Cancer Care, Dr. Amanda Ruth, who's Head of Policy and Public Affairs for Rare Cancers Australia. Amanda has worked as a journalist and in leadership roles in market access, policy and government affairs, and she also has completed a PhD in immunology. Please welcome Amanda.
Good morning, Sophie. It's my pleasure to say hi from Melbourne this morning and to talk about Vision 2030 and explain to you what it actually is. It's an aspirational outlook for cancer care over the next decade. The philosophy of the vision was grounded in the belief that every life's important, every patient matters, and that everyone deserves to have access to the best technologies and treatments when they need them. There's an opportunity to save lives, and you'll hear a lot about that today, and we'll tell you why it's actually true. But it's really because of the emergence of exciting new discoveries in cancer care and technologies. And this is because of the wealth of research that has been conducted in cancer that outstrips any other disease area. As you heard earlier, Vision 2030 is built on collaboration. And I'm very proud to be part of the National Oncology Alliance. It's an alliance like no other in that it includes a growing stakeholder membership base of over 400 stakeholder groups across the entire cancer continuum, from patients individually to carers to physicians, experts, industry, hospital networks. The breadth of the membership is just growing and growing, and this brings a depth to the discussions and collaborative feedback that enriches what we're trying to do today. The National Oncology Alliance partnered with the Minderoo Foundation to understand what's happening now, what's coming in terms of technology and therapy, and where the gaps are. We wanted to know what patients need and want from their own mouths, and to have the best model of cancer care that we possibly can have in 2030. As you heard, we consulted widely and broadly through workshops with many, many attendees. And along the way, we heard about exciting discoveries in new cancer technologies and heard inspiring stories of bravery and tragic stories of loss. It's been a remarkable and educational journey to be part of. Thank you to all of you who collaborated with us over the past year. As Australians, we can be proud of our healthcare system and what we've achieved overall in the preceding decade. We have one of the best overall survival rates of cancer as a group of diseases globally. Yet, sadly and distressingly, this does not extend to every single cancer type or cancer subtype, and is not the case for rare and less common cancers. Rare and less common cancers represent half of all cancer deaths. And despite how far science has progressed, cancer is still Australia's most fatal disease. Sadly, we know that over 500,000 people will die between now and 2030 if we maintain the current course. This is an astounding number, but behind every number is a patient, their story, their family, and the impact on them moving forward, and not to mention long-term societal and economic impacts. They are the reason that we're here today and the reason why we decided to embark on Vision 2030 to create a known future. We want to get the right treatment to the right patient at the right time to make a difference. Changing this relies on planning ahead and preparing, and if we're successful, we can save lives. It's a bold statement, yet a 90% rate of survival across all cancer types is possible, no matter how rare the cancer is. We've seen these great survival rates being achieved in common cancers like breast and prostate cancer because of the investment in screening programs and diagnosis and delivery of targeted therapies. We can extend this to all cancers, and we know that we can extend this to all cancers if we do this now. This will have a huge impact on families, and the outcomes are made possible through genomics, artificial intelligence, personalised treatments, oncology, immuno-oncology, and big data. Genomic sequencing of cancers has helped us to understand the molecular makeup of cancers and has given a rise to rare subtypes of cancers. Some of these molecular characteristics are druggable, giving rise to personalised medicine. This means that medicines can be, or therapies can be targeted to a person's unique cancer type. These new approaches are converging with different treatments such as radiation oncology, artificial intelligence, and leveraging these can occur at the same time, which will create complexities for our healthcare system. We have to be reminded why we are here today, because it's easy to get caught up in the science, it's easy to get caught up in the systems, but we cannot lose sight of the people. We're here today because of the cancer patients of today and tomorrow, and for those who we have tragically lost along the way, like Annabelle, who you'll hear about later, Scott, Ash, Madonna, and little Ned. And we thank their families for so generously offering their stories. And if you want to learn more about them, please read the report. Patients need to be front of mind in everything that we do. And they have told us directly what this means to them. So we have an obligation to be advocates for them. We started Vision 2030 with our goals at the forefront of our minds of what we could achieve over the next 10 years. We envisage Australia having a fully patient-centred healthcare system, and as taxpayers and contributors to society, we believe that it's the fundamental right of every patient to have access to the best technologies and treatments when they need them. Australia can have a thriving industry that will benefit both patients and the economy, and attracting investment in local clinical trials is fundamental in delivering cutting-edge treatments and ultimately securing the commercial pathways to the broader clinical setting. This will elevate Australia as a country recognised globally as one that models best practice for cancer research. While we are in a good place as a country overall, we can do better, and patients have told us through their experiences that is not necessarily the truth for each person. I'm now really excited to take you through what we see as the way forward, the Australian Cancer's Futures Framework. And you've probably heard about it a few times this morning and wondering, what is it? Well, we believe it is the first step in making the vision aspirations a reality. The framework aims to increase the utility and availability of cancer treatments and technologies to save lives. We need a holistic approach to delivering cancer care because, unfortunately, what we learned from the workshops is that there are already a lot of silos within the health system and patients are slipping through. It's not a consequence of having a terrible system or a criticism, but it is a consequence of the profound changes that are coming in technology and therapy compared to 20 years ago when these frameworks and systems were first designed. Just looking at the outstanding breadth of research and clinical work gives us inspiration to think how we can do this and bring it together so that patients can be the beneficiaries. The framework provides a mechanism to conduct deep dives and research into each of the 6 pillars so that we can understand what we need to do, look at the infrastructure, look at changes in policy, even legislation, how much it will cost, and what will the economic returns be for implementing these things. But one point is particularly clear, is that we need to move forward and we need to think about a way to look at health as an investment rather than a cost. Because sometimes there is a high upfront price to pay for a particular therapy or a treatment, yet the long-term benefits could be saving a life, returning a person back into the workforce. And this has never been more of a reality than it is now. So we really need to measure this and look at these things realistically. Now, I'm going to quickly take you through the pillars of the framework, and then you'll hear from other really inspiring speakers today who are experts in genomics and artificial intelligence. So, pillar 1, patient-centred care. It's never been more important. We've been told realistically and practically what patients want and need. And there are two fundamental areas that we can do better. One is patient empowerment, engagement, support, and helping them to understand information so that they can make decisions when they need to. And the second relies on the use of tools to capture and measure patient preferences and needs. When resources are constrained, like they are, there's never been a more important time to take on and listen to what patients want, both from a personal perspective, but also from a system perspective. Pillar 2 focuses on research and clinical trials, and there's also so much that we could do in this space, but we've thought about what's most important right now and what's going to make the greatest impact. And we think that is trying to reach those patients in rural and remote areas by bringing them teletrials. And this will be particularly impactful for people with rare cancer subtypes. Pillar 3 looks at genomic sequencing. It's a new, exciting area of progress that's just opened up a world of possibilities for patients, and you'll hear more about it today from Professor David Thomas. Through the National Oncology Alliance, we have learned that there is the potential to conduct tests for known genes, known genetic signatures, or conduct even whole genome sequencing using next generation sequencing technology. That might sound like a mouthful because it is, but NGS is a really fast method that enables us to sequence an entire genome or a person's entire cancer, and it generates so much data. And when looking at the data, it's hard to know whether you can actually find a marker of relevance that's related to disease, and then whether that marker is going to be druggable. But there's the potential for that. So we need experts, we need people on molecular tumour boards, we need to use artificial intelligence to sort through that. There's a lot of potential there. We went one step further with the genomic research, and we did a blueprint horizon scan with HT analysts. They undertook extensive stakeholder consultation, desk-based research to understand what's happening now, what are the experts doing in genomics all around the country, and what would it mean to bring this technology to patients more broadly, and how would we do it? So the next phase is to look at how to best make this available, and we believe to advance cancer patients who are on non-curative pathways. We conclude that this is both in the research setting initially, because there's still a lot of work to be done, and also more broadly later in the clinical practice setting. Pillar 4 of the framework focuses on artificial intelligence, the way of the future, or maybe even the way of the present. It can be used to find patterns and interpret images more precisely and effectively than the human mind, as well as digitally integrate patient preferences. It's an amazing tool and it has so much potential. It will focus on what technology is available, how to leverage it broadly, how to make it accessible. We want to have a national approach to AI delivery and to think about it in advance so that we can plan ahead and do it meaningfully. Pillar 5 looks at big data, and we always hear that term big data, big data, big data, but what does it mean? Well, we know that there are going to be evidence gaps in future, particularly around emerging therapies like CAR T therapy that was approved for reimbursement based on very early evidence and with promising results never before seen. There's a potential to use real-world evidence to fill the evidence gaps. Through the workshop series, we understood the relevance and importance of disease registries like the multiple myeloma registries and the lymphoma and related disease registry. We initially thought that why not create a national cancer registry? That would be really important. But we realised we could take this one step further because there's so much data. There's 300 gigabytes of data for one whole genome sequence per person. So basically that's a lot. We thought we could propose a national cancer data commons similar to what's been done in the US, but tailor it for Australia. This would be a web-based repository for data that people could access, use and share, and also house genomic data. We could apply artificial intelligence algorithms to it and predict treatments, and the potential is just endless if we can get it right. Pillar 6 is last but not least, and one very dear to our hearts, which is access to the best therapies and technologies for patients at a price they can afford. And this is not something that's new. This is something that a value that our country has embraced over the last 20 years, and it's part of the National Medicines Policy, which is going to be updated. But what we at Rare Cancers Australia and through NOAA know and acknowledge every day is that there are patients that ring our patient care team that cannot access the therapies they need. So we want to have an interim fast-tracked access program. We acknowledge the need to retain an evidence-based decision-making model and maintain the financial integrity of the health system. But we also know that the changes in technology and the changes in the types of evidence coming through don't really match a system that was designed 20 years ago to evaluate small molecules for patient populations that consisted of thousands of people. Things have changed a lot. There have been some adaptations to the pathways that are used for evaluation, but we can argue whether that's going to be enough to uphold the values that we hold dear and that are important to us moving forward. A lot has changed. So another complicating factor will also be the use of multimodalities, which I talked about before, and that's sort of a bit of a jargon term, but what it means is radiation oncology with a targeted therapy using AI and big data all together at once. You know, how on earth do we evaluate the effectiveness, safety, and comparative costs of these things? So we want to look at potentially having one overarching committee. The answers are sometimes obvious and sometimes not. There's a lot of work to be done. I'd like to just take you to the last slide and also just say with that, patients can't afford to wait. Cancer patients in particular can't afford to wait for access to the best treatments. They can't wait for years, and sometimes they can't wait for months. And a favourite quote of mine is, the time to repair the roof is when the sun is shining. So let's get, and that's a quote from Kennedy. So let's get going and do the work now so that we can have one of the best healthcare systems and be leading in cancer care in the future. And we owe it to our patients. Thanks a lot. Thanks, Sophie.
Thank you very much, Amanda, for that great insight into this really important report.